Hello, and welcome to our April 10th Veterans Town Hall. First, I would like to share some information about our main hospital, including commonly requested phone numbers on your screen. So you can see that we have several numbers that you can contact. If you would like to schedule an appointment, that is the first number that you see at 708 202 2707, followed by our mental health clinic. The direct line for that is 708 202 2002. My Healthy Vet, 708 202 5633. Patient Advocate Office, 708 202 2716. Medical Records Office, 708 202 2121. And lastly, our Enrollment and Eligibility Office, which is 708 202 8838. All right. So today's Veterans Town Hall also highlights our Joliet CBOC. In the first 4 months of 2024, the Joliet CBOC has completed more than 15,000 face-to-face video and telephone visits. Some of the healthcare services includes primary care, women's veterans care, podiatry, optometry, mental health, and more. In addition to these healthcare services, the Joliet CBOC also offers weekly chaplain services for veterans and their families every Friday at 1 p.m. or by appointment, as well as an on-site veterans computer lab and mobile food pantries in the main patient parking lot. The next one is scheduled for Thursday, May 30th. You can find the Joliet CBOC contact information on your screen. If you have any specific questions, please comment below or send us a Facebook message. We will get back to you as soon as possible. Now, since we are in the month of April, I have a few updates for our April events. We're already off to a busy start. On April 4th, our Whole Health team hosted a Veteran Whole Health Fair in the front lobby. In case you missed it, we have 2 more Whole Health fairs happening April 18th from 10 a.m. to noon at the Kankakee CBOC and from 1 to 3 p.m. at the Hoffman Estate CBOC. These fairs feature pertinent resources, promotional materials to support well-being, and the opportunity to complete a personal health inventory, which is a tool used to consider what's most important, to assess your progress, and where you might want to make a change. We hope to see you there. Earlier today, we hosted our annual Limb Loss Awareness Month gathering event in the atrium. The event, which brought together amputee veterans, providers, technicians, and vendors, featured new amputation technology demonstrations. At this time, we will now have a HRO safety story presented by Mr. Kaizo Beck.
Thank you for that, Ms. Morris. Good afternoon, everyone. We'll start with our safety story. While walking around the facility grounds, an administrative officer noticed an elderly veteran walking gingerly with a cane. The veteran's gait appeared unstable and he looked lost. The veteran stated that he was on the way to his physical therapy appointment. Seeing that the veteran was a high fall risk, the administrative officer, demonstrating preoccupation with failure, offered to escort him to his appointment. At first, the veteran refused, but the administrative officer made the veteran feel at ease by joking with him, so the veteran felt more comfortable accepting help. After the veteran arrived at the appointment, the administrative officer requested that the veteran be provided with an escort and wheelchair service to take him to his next destination. The officer reached out to the Veterans Experience Office to offer ideas for improvement regarding this experience with vulnerable veterans. By helping this specific veteran, but also working with the Veteran Experience Office in thinking about the future, the administrative officer anticipated and reduced the risk of physical harm for veterans. And this concludes our safety story. I will now introduce Dr. Richardson for medical updates.
Thank you, Mr. Bach, and good evening again, afternoon, everyone. Medical update today that I wanted to speak to you about was just to remind everyone that as we now have spring here, there are a couple of things that we must be aware of. First of all, our springtime is the time for allergies. Usually as we think of allergies, as the flowers come out, we sometimes think more of our allergic sinusitis or allergic bronchitis. But I want to remind everyone with lower respiratory disease, particularly with asthma and COPD, that allergies in the spring can be a trigger for your bronchospasm, for the shortness of breath that you might feel as you're outside. And therefore, this is a time to make sure that you have with you your rescue medication if that becomes necessary. The other issue in spring that I always remind people is that now is the time to look again at your goals for exercise and weight. Over the holidays, many times we stay inside, and now is the time to again set our goals so that we have our target goals for the rest of the spring and the summer. And then last of all, I want to remind everyone that still we have a few days left for flu vaccination, and also if there are other vaccinations or that you may need, certainly speak to your physician and make sure that you are up to date with all your immunizations. That's all the update I have for today, and I'm going to ask Mr. Molina to come and speak about the PACT Act.
Thank you, Dr. Richardson. So honoring our promise to address Comprehensive Toxics Act, or the PACT Act of 2022, has made another significant change that will impact veterans, which is addressed in Section 103 under the PACT Act. Next slide. This presentation provides an overview of the key PACT Act elements, such as what is the PACT Act, who is eligible for care under the PACT Act, what is a toxic exposure risk activity, how do I apply for VA healthcare? Why should I apply for VA healthcare? What is a toxic exposure screening? What are the presumptive conditions under the PACT Act? And how do I file for claim benefits? Where can I find more information? I've highlighted the toxic exposure risk activity, or TARA, which is what Section 103 addresses. The PACT Act is a very comprehensive and addresses the full range of issues impacting toxic exposed veterans and their survivors, and will help VA meet the growing needs of veterans and in the future. The PACT Act, which expanded VA healthcare eligibility even further with a change that took place on March 5th, 2024. It improved VA's presumption decision-making process. It bolsters VA's toxic exposure resources for veterans and their families, strengthens VA's toxic exposure research, increased VA benefits claims processing capacity, strengthens VA's workforce, and authorized funding for VA facility leases. Under the PACT Act, all toxic exposed veterans were supposed to become eligible for VA care in increments. Between now and 2032, with a new change, VA eliminated the phased-in approach, meaning that 3 new cohorts of veterans are now eligible to enroll in VA healthcare as of March 5th, 2024. Veterans who participated in a toxic exposure risk activity, or TARA, as defined by law while serving on active duty for training, or inactive duty training. Veterans who were assigned to a duty station in certain locations during specific periods of time. On or after August 2nd, 1990, in the following countries: Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, or the United Arab Emirates. On or after September 11, 2001, in the following countries: Afghanistan, Djibouti, Egypt, Jordan, Lebanon, Syria, Yemen, Uzbekistan, or any other country determined relevant by the VA. Veterans who were deployed in support of Operation Enduring Freedom, Operation Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, Operation Inherent Resolve, and Resolute Support Mission. So what is considered a TERA, or Toxic Exposure Risk Activity? VA has determined that veterans who were exposed to one or more of the following hazards or conditions during active duty for training, or in active duty training participated in a TERA, or Toxic Exposure Risk Activity. Those can be air pollutants such as burn pits, sand dust, particulates, oil well fires, and sulfur fires. They could also be chemicals that were contained in pesticides, herbicides, depleted uranium with embedded shrapnel, or contaminated water. They could also be occupational hazards, such as asbestos, industrial solvents, lead, paints, including chemical agents, resistant coating, and firefighting foams. It also includes radiation that could come from nuclear weapons handling, maintenance and detonation, radioactive material, calibration and measurement resources, X-rays, nuclear weapon technicians, and dental technicians, served on nuclear submarine and other nuclear ships, or in shipyards, or were involved in nuclear weapons handling and maintenance. They could also be warfare agents, such as nerve agents, chemical, and biological weapons. This is not a comprehensive list, and there is no timeline. Veterans can view additional military exposure categories on VA's public health website. With this TERA activity as well, you don't have to have been exposed to these toxic exposures in combat. Next slide. So the Vietnam era VA healthcare eligibility, which is another category. Veterans who served in the following locations and time periods are also eligible to enroll in VA healthcare, which was effective on the enactment on August 10th, 2022. Veterans who served in the Republic of Vietnam between January 9th, 1962 and May 7th, 1975. In Thailand at any U.S. or Royal Thai base between January 9th, 1962 and June 30th, 1976. In Laos between December 1st, 1965 and September 30th, 1969. Certain provinces in Cambodia between April 16th, 1969 and April 30th, 1969. Guam or American Samoa or the territorial waters between January 9th, 1962 and July 31st, 1980. And Johnston Atoll, or ship that called there between January 1st, 1972 and September 30th, 1977. If you served in these areas, it also includes the territorial waters and the airspace above these countries. Next slide. So you can apply for healthcare in 4 easy ways. If you qualify under the PACT Act, you can move up in a priority group and you can submit a 1010 EZR in the same manner. The 1010 EZR is just an update to your already existing healthcare application. You can apply online at va.gov. You can call the toll-free hotline 877-222-8387. You can mail the VA form 1010EZ or the 1010EZR to the Health Eligibility Center, 2957 Claremont Road, Suite 200, Atlanta, Georgia, 30329. Or the best way to do so will be in person at the nearest VA medical center or clinic, preferably Hines, as we are a little biased. But any VA clinic can be, you can submit your application. Make sure that if you're filling out a hard copy, make sure you have the 1010EZ and 1010EZR completed with the March 2024 version. You can find that version on the va.gov website. Also include any necessary documents such as your DD-214 and any other income-based information. So why the VA? The VA provides the best and most affordable healthcare for veterans in America, and this is your chance to apply. Veterans who are enrolled in VA healthcare are proven to have better health outcomes than those who get their healthcare elsewhere. And this year alone, VA has beaten non-VA hospitals in quality ratings and patient satisfaction. That's because our clinicians know veterans. They are often veterans, and they know exactly how to help. Although I'm not a clinician, I am a veteran, and I utilize VA healthcare. VA healthcare isn't only the best option for veterans, it's also the most affordable. Veterans can expect copays as low as $0 for prescriptions, urgent care, outpatient care, and more for some veterans at the VA. So don't wait, get the world-class care you've earned. As part of the PACT Act, the VA has been instrumental in getting veterans screened for toxic exposure. Some quick facts about the toxic exposure screening. It's available for all veterans enrolled in VA healthcare. It's a brief screening that takes about 5 to 10 minutes and it identifies and documents any potential exposures to toxins during your military service. It is done at least once every 5 years, and it's done at any VA medical center, clinics, and even to include virtual appointments. We are doing this to support the long-term health plan of the veteran, ensuring they receive informed, whole health care, and connect them with the follow-up resources as requested. Other resources to include with the PACT Act, you could go to va.gov/PACT. You could apply for healthcare at the same website, or just go to va.gov. You could file for disability on va.gov as well. And if you are interested in submitting or registering for the airborne PITS and registry, please visit va.gov and you'll find the information on that website. Next, we'll have Karen McLean to give you an update on the Women Veteran Celebration.
Good afternoon, everyone. I'm here to introduce our Celebrating Women Veterans event scheduled for April 27th at Kankakee Community College. We are inviting women who served in the U.S. Armed Forces to attend a resource fair on Saturday, April 27th from 10 a.m. to 3 p.m. at Kankakee Community College, Building L in Kankakee, Illinois. This event, called Celebrating Women Veterans, is organized by Hines VA Hospital, which operates an outpatient clinic in Bourbonnais, Illinois. And it is our sincere hope to connect women veterans at the event with services unique to their needs. Services offered will include financial management, career coaching, suicide prevention, intimate partner violence support, military sexual trauma support, caregiver support assistance, whole health resources, mental health resources, reproductive women's health resources, maternity care, homeless outreach, as well as women's primary care and gynecology resources, personal wellness, including massage therapy, yoga, Reiki. Entertainment will be provided by DJ Raquel, who is an Air Force veteran. Illinois State Representative and Marine Corps veteran Stephanie Kifowit and Air Force veteran Dr. Renee Dickerson will be among our guest speakers. This event will also feature organizations and agencies that aid women veterans. Among the attending groups are the Social Security Administration, Illinois State Treasurer's Office, Top Flight Defense, Volunteers of America, Ileana Lady Veterans, Wounded Warrior Project, Merging Veteran Players, Dog Tag, Be Whole with Nicole, She Force, Shiro Coffee, Brushwood Center, Art Tribe, Local Color Art Studio, the Inner Sparkle Effect, DuPage County Veterans Assistance Commission, Chicago Vet Center, Forest Park Vet Center, Rich Township Assessor's Office, Northwest Hispanic Chamber of Commerce, Above and Beyond Family Recovery Center, Illinois Joining Forces, Operation Support Our Troops, Humana, Park Place, Delta Dental, Honor Flight, Allen Force, Team Red, White, and Blue, and Canines for Veterans, and many other organizations. Veterans can also enroll for VA healthcare and benefits during this event. To enroll, the applicants should bring a photo ID and a copy of your DD-214 military discharge form. Free childcare will be provided, and parking is also free and available, and complimentary lunches will be provided. We encourage advanced registration, but it's not required. To register, you can click on the QR code on your screen with your device, or you can visit www.hinesva.hospital/celebrate women vets. Kankakee Community College is located at 100 College Drive in Kankakee, Illinois. This event will be located in Building L, located on the northern section of the Riverfront campus. I hope to see everyone there. I will be followed now by Sarah Gavin, our outreach coordinator.
Thank you, Karen. I'm Sarah Gavin from the Hines Outreach team, and I want to share some of the spring-April events that are coming up. Now, this is not an entirely inclusive list of everything that outreach will be attending or our service lines, but these also have a varying amount of indoor and outdoor activities that are available for veterans of all varying counties. So coming up on April 11th, which is Thursday, there's going to be a Veteran Resource Fair in Westchester at the Westchester Park District. That is 10835 Wakefield Street. Coming up on the 18th, there's a few events. Kendall County VAC and Hines VA outreach team will be at the Yorkville American Legion at 9 a.m. to 2 p.m. at Stevenson Park. The Veteran Fair following that is in Stevenson Park in Bellwood. Coming up, also in Oak Park, pretty local to the Hines VA facility, the Oak Park Community Health and Wellness Fair from 11 a.m. to 2 p.m., where resources will be available for seniors as well as veterans. Next slide, please. Every third Sunday of the month, Allen Force hosts a She Force event, which is available for both veterans and any woman that is affected by military service. And that's going to be at the Plainfield Community Center. This one coming up on April 21st is going to be Uncovering Your Inner Strength. Friday, the 26th of April, there's a Senior Health and Wellness Fair at the Elgin Community College. And that one is being presented to have information for seniors, community caregivers, as well as veterans. Karen, I know, was just speaking about our upcoming Kankakee Community College event at the Celebrating Women's event from 10 a.m. to 3 p.m. That is open also for all women that are affected by military services, including indoor and outdoor activities. On that following day, on the 28th, Sunday, the Good Life Race is going to be going on at Oak Park. They have a 5K, a youth mile, and then also a junior dash that's available from 10 a.m. to 2 p.m. The American Legion, the Cicero Post, is going to be hosting on May 4th a car swap meet and classic car show at Morton College. So please take a peek at what's available, and if you need any more information, like I said, for a full inclusive list, please reach out to the Hines Outreach team, and that will be hinesoutreach@va.gov. Next, I'd like to introduce from the Intimate Partner Violence Program, Erin Henry. Thank you.
Good afternoon, Hines veterans. Thank you for being here. I'm Erin Hanrahan. I'm the Intimate Partner Violence Program Coordinator. And our Intimate Partner Violence Program provides comprehensive and supportive services to veterans, partners, spouses, and caregivers that are impacted by domestic violence. Some of the services that we offer are screening and assessment, safety planning, referrals in the VA and outside of the VA, and then also some clinical interventions such as Strength at Home and RISE. I am also here today to talk to you. April is Sexual Assault Awareness and Prevention Month. I wanted to let you know that we have two military sexual trauma groups, two cohorts. We have a males group and we have a females group. So if you would like a referral to those groups, you can ask your provider. I also want to let you know that April, an easy way to raise awareness and support Sexual Assault Awareness Month is to wear teal. And then on April 24th, we have our Denim Day. And so Denim Day is our campaign that was created to show support to survivors of sexual violence everywhere, regardless of age, gender, sexual orientation, race, or ethnicity. So the VA supports survivors of sexual violence, regardless of when and where the incident occurred, and VA is dedicated to fostering an environment where sexual harassment and sexual assault is never tolerated or condoned, and where people who experience sexual harassment and sexual assault can be heard and supported. I also want to let you know that last year we did a clothesline project, which survivors of sexual violence created t-shirts. And those are still hanging in our Hines atrium. So when you're on campus, I encourage you to view those. They are between the Hines canteen and the post office. You also can check out our website, our Hines website, and social media posts. And then again, if you need direct help in regards to intimate partner violence, please contact me at my phone number there. And then also for any MST related questions or concerns, you can contact Dr. Pereira. I also want to acknowledge our White Ribbon campaign. So our White Ribbon campaign aims to eliminate sexual harassment, sexual assault, and domestic violence in our healthcare system, and also promote a culture of change when we're all here at the VA. I would encourage you to take the White Ribbon Champion Pledge, which you see the link to our White Ribbon USA website. And again, that pledge is just acknowledging that you will not condone or stay silent or excuse sexual harassment, sexual assault, and domestic violence in our healthcare system. Next slide. And then lastly, I want to inform you of two other awareness that we have going on. So you will now start to see the universal sign for help posted in all of our public restrooms on Hines campus and at all of the CBOCs. So the Department of Veteran Affairs is adopting the universal sign for help, and this was originally created by our Canadian Women's Foundation. This provides a nonverbal way and discreet way that somebody can request help if they're experiencing a crisis that you see listed. Once you scan that QR code, it'll take you to a resource page. But I do want you to know that there is a discrete hand signal that us as staff will be responding to, and that is one hand folding the four fingers over the thumb. And so again, that being a discrete sign that you can let us know that you may need help. Lastly, I want to introduce you to the Relationship Health and Safety Clinical Reminder. This is a clinical reminder that has launched. This is our Intimate Partner Violence Endorsed Screening that is rolling out. So you will hear from your providers asking you to complete this screening, which allows the healthcare team to provide early education, safety planning, and referrals to our IPVAT program. Currently, this screen is active for women veterans age 47 and younger, so childbearing age, but it will ultimately be launched for all veterans through our healthcare system. So again, I want you to know that there is help available. You also have access, again, to the Intimate Partner Violence website that's located there, and again, you may reach out to me. Next, I'm going to introduce Jennifer Cross for patient privacy.
Good afternoon, everyone. My name is Jennifer Cross. I'm the privacy officer here at Hines. I will be discussing veterans' privacy rights. Okay, a veteran has a right to confidential communication, mailing to a confidential address that would be other than your residential address. There's no emailing. A veteran has the right to opt out the facility directory. This is only if your inpatient status does not apply to ED or outpatient settings. The right to an accounting of disclosures, a list of all disclosures of information, written or oral, from the records to any person or agency. And also you have the right to request a SPA report, and that's basically an audit of your medical record. A right to file a privacy complaint, a written complaint with the privacy officer. Always start with our office, and then if we're not able to assist, you can always go to OIG and even the VHA privacy office. Next slide, please. Veterans' privacy rights is also the right to obtain a copy of your health information. You have the right to review and obtain a copy of your health record, the health information in your record. And you also have the right to request an amendment of your health information. You have the right to request an amendment. Basically, it's a correction to your health information in your record if you believe it's incomplete or inaccurate or untimely, or unrelated to your care. Next slide. A veteran also has a right to obtain a copy of the printed privacy notice of privacy. You have the right to obtain the additional paper copy of the notice from your VA healthcare facility. You can obtain this notice of privacy from the privacy officer at your local VA healthcare facility. There's also a web address at the bottom where you can go on the website and print this a copy of the notice of privacy practice as well. Okay, a notice of a breach of your healthcare information. If a breach of any of your protected health information occurs, our office, the privacy office, will notify you and provide instructions for further actions you may take if any is necessary. Okay, when we may use or disclose your health information without your authorization. For treatment purposes, we may use or disclose your health information without your authorization for treatment or to provide health care services. Payment, we may also use or disclose your health information without authorization for payment purposes or to receive reimbursement for care provided. If there are any privacy questions that you may have, that's my contact information at the bottom. Also, I have an alternate privacy officer. You can contact either one of us at our desk, or that's at the bottom. Also, there's an email address that you can contact us at as well. Okay, the next person that we have up is Karen for the Aging Brain Virtual Workshop, Ms. Andy.
Hello, I'm Ann Day. I'm a psychologist here at Hines, and I'm here to tell you about the opportunity to attend a virtual workshop next Tuesday, April 16th in the afternoon. This workshop is part of a series that's put on about twice a year, a collaboration between home-based primary care and our neuropsychology program. The first part of the workshop, it happened last week, so we'll get this out earlier next year, which is a workshop about caring for a healthily aging brain. The workshop that's coming up next week is for caregivers of veterans with dementia, or it's for veterans who are themselves the caregivers of maybe a spouse or someone that they know who has dementia. In order to register for this workshop, please contact Dr. Amanda Urban in our neuropsych program. Her phone number is up on the screen, 708-202-2682. And from that contact, she will find a way to get you a link to attend the virtual workshop. During this time, we'll be covering ways to care for someone who has dementia, focusing on the care of people in the home. And we'll talk about managing specific challenging behaviors and talking about ways for caregivers to manage their stress during this very challenging time in their lives. Thank you. The next up will be Miss Angela Morris talking with closing remarks.
Well, thank you, Team Hines, for sharing all this great information. As you guys can see from the content that was shared today, there's a lot of opportunity for resources that you may not have access to. So we welcome you to come to Hines or our local CBOC locations. If you are not currently a patient, feel free to come in. There's a lot of information that Mr. Molina provided, especially regarding the PACT Act. We definitely want to make sure that all of our nation's heroes have access to care. With that being said, feel free to bring a friend, because we definitely want to make sure that if you notice you're receiving care here, if there's a fellow veteran out there who is not, there are plenty of services that we have to offer here. That brings us to a close. Thank you again for joining us today. Feel free to utilize any of the contact information that was shared during today's call, and please join us again next month. Bye, everyone.